first people to lead the battle against atopic dermatitis. She is Masako Mizoguchi, professor and director of the Department of Dermatology at St. Mariana University School of Medicine in Kawasaki City near Tokyo. She has been researching skin-related allergies for over 30 years. Melinda Hull had a chance to meet with her earlier, so let's have a listen.
I'd first like to thank you, Dr. Mizoguchi, for taking the time to be with us here today.
It's my pleasure.
Now, I understand that you were recently involved in a seminar that was on the topic of atopic dermatitis.
Yes. On 28th of August, I talked to the people who are working for media on atopic dermatitis, especially on its pathogenesis and treatment.
By pathogenesis, you mean its cause?
Oh, yes, it is.
Now, why were you talking to the media? Why is there so much interest in atopic dermatitis among the media?
Maybe because the number of patients has dramatically increased recently.
Now, could you first tell us exactly what is atopic dermatitis?
Yes, atopic dermatitis is a kind of inflammatory, non-infectious skin disease. Hereditary disposition is deeply related to the pathogenesis of this disease. The clinical findings and the cause of this disease are very characteristic. Acute and chronic eczema-like eruptions, which cause itching, are symmetrically distributed over the body, especially on the face, neck, and extremities. Atopic dermatitis is refractory with repeated relapse and remission. The word atopic originates from the Greek atopos, which means not a proper place or strange. In 1922, the words were first used for diseases such as hay fever, allergic rhinitis, and allergic asthma. In English, they say atopic instead of atopes. In 1933, Dr. Salzberger named atopic dermatitis for a kind of eczema which was originally called endogenous eczema and had the same characteristics as those of the present atopic dermatitis.
Now, I go to the gym in Tokyo quite frequently. I go there many times in a week. And when I'm changing clothes, I may notice, or I sometimes notice, a woman will be standing next to me, and she's also changing. And she'll have a very, not just a small rash, but she'll have a rash over the almost entire body that looks very, very painful. Now, is this what you call atopic dermatitis?
Well, if it's painful, looks painful, or itching. Mm-hmm. In case of painful, it's not atopic dermatitis. But if she has severe itching with such eczema over the body, it may be atopic dermatitis.
Now, okay, I'm changing in the gym and I look at this woman. Now, some people might think, my goodness, I don't want to be near her. But as you said in your definition of atopic dermatitis, it's not infectious. So there's no chance of catching it, is there?
No, it's impossible to suffer from atopic dermatitis by touching patients.
So you don't have to worry about getting anything bad from the person standing next to you in that case?
No.
Now, as I said, well, I go to the gym in Tokyo, but when I was in school in the United States, I also, in the same way, went to the gym regularly in the United States. And I don't ever recall seeing anyone with that type of skin condition, with a rash over their body. Is there a difference in the occurrence of atopic dermatitis among different countries?
I don't know the exact number of atopic patients in other countries, but according to many papers which investigate the number of atopic patients, other country also has the same problem. I mean, increase of atopic patients.
Now, why, you mentioned before and you just stated now that there seems to be an increase in the number of people suffering from atopic dermatitis. Why is that?
We don't know the reason exactly, but maybe because of the change of environmental factors. Because in Japan, our lifestyle is changing a lot after the Second World War. They say this is one of the causes of atopic dermatitis.
Now, you said when you defined atopic dermatitis that it's hereditary, so that you're genetically predisposed to getting atopic dermatitis. But is heredity the only factor in what causes atopic dermatitis?
No. Besides hereditary disposition, there are several factors which induce or worsen atopic lesions. But the cause of atopic dermatitis has not been clarified yet. But there are several factors. Two main factors. One is abnormality of skin functions, especially barrier function of the skin surface, which prevent the skin and body from many things such as dry weather, sunlight, and penetration of irritants and allergens. And other main factor is allergens such as mites, bacteria, fungi, and many kinds of food. Most patients have antibodies, allergen-specific antibodies, which belong to IgE class. And we don't know such allergen exactly induce or worsen atopic lesions. We don't have definite proven for that. Therefore, we only know suspected allergens.
Now, I also, in addition to going to the gym, sometimes go to the hairdresser. And I was talking to her that I noticed that a lot of women that I see on the train, in addition to men, seem to be losing their hair. And I don't want everyone around the world to think all Japanese women are bald. But, and she just simply said that it's an increase in stress level, that you do see hair loss in older women. Now, does stress also have an effect on atopic dermatitis?
Yes, stress worsens atopic lesions. I have patients of medical school students. Their lesion became worse when they take examination.
Now, is there any cure for atopic dermatitis, or do you just have to suffer through it?
If we knew the exact cause of atopic dermatitis, the best cure would be to exclude the causes. But we only knew suspected allergens, and it is hard to exclude such allergens from ordinary life. Therefore, we usually use drugs to suppress symptoms of atopic dermatitis. We use topical steroids to suppress inflammation, and we use emollients for dry skin, combined with systemic antihistamine to suppress itching.
How successful are these treatments? Does the rash go away completely, or does it only just become slightly alleviated?
Well, unless they are not so severe, most patients are well controlled by this therapy. But severe patients, it is hard to control their skin eruption, even if we use those drugs. For that case, we use UV light or systemic immunosuppressants.
What kind of people what is the typical atopic dermatitis patient? Does it affect everyone equally, or are there certain groups that affects more?
I think people who live in big cities easily suffer from atopic dermatitis than people who are living in countryside. So many environmental factors such as air pollution may be related.
Does it affect all age groups equally?
Children suffer from atopic dermatitis. And 20 or 30 years ago, atopic dermatitis is a disease for only children. But recently, adult patients increased in number.
Now, what kind of exchange is taking place on the international level about this problem?
We exchange many information such as diagnostic criteria, pathogenesis, especially effective therapy, through journals and international meetings.
And what directions do you expect to see research in this field move into?
There are two main directions. One is to develop effective drugs. The other is to investigate or to clarify the pathogenesis, including genes related to atopic dermatitis.
Well, Dr. Mizoguchi, I'd like to thank you sincerely for taking the time to be with us here today.